You know, there's a microscopic war being waged inside the human body, a battle of biology, of chemistry, and pure survival against an enemy we've been fighting for millennia. So in this explainer, we're going to pull back the curtain and see exactly how we fight back.
And that's really the central question, isn't it? Malaria isn't just some run-of-the-mill bug. We're talking about a highly sophisticated parasite that has perfected the art of invading, multiplying, and spreading. So how in the world do you outsmart something like that? Well, the answer lies in understanding its greatest strength and, it turns out, its most fatal flaw.
Okay, first things first, let's meet the villain of our story, the Plasmodium parasite. This tiny, single-celled organism is the mastermind behind malaria, and believe me, it has a very specific, very effective plan of attack.
Now, what's really fascinating is just how strategic this parasite is. It's like a four-step invasion plan. It starts as something called a sporozoite. That's what gets injected by a mosquito. Then, it matures into a trophozoite, and its main job is to feast on our red blood cells. After that, it becomes a schizont, which is basically a reproduction factory, just churning out copies of itself. And finally, it develops into Gametocides, which are ready to be picked up by another mosquito to start the whole cycle over again.
But for our story, the stage we really need to zoom in on is that second one, the trophozoite. This is what you might call the feasting stage. And this is where the parasite is actually at its most vulnerable. And why is that? It's because it's eating. It literally burrows into our red blood cells and just gobbles up hemoglobin, the protein that carries all our oxygen.
And here is where the story gets really good. Because while feasting on all that hemoglobin gives the parasite everything it needs to grow, it also creates a massive, life-threatening problem for itself. It's kind of like a burglar who breaks into a candy store but is deathly allergic to sugar.
And that fatal flaw? It's its own toxic waste. See, when the parasite digests hemoglobin, it releases this byproduct called heme. And heme is incredibly poisonous to the parasite. So the very act of eating, the thing it needs to do to survive, could actually kill it from the inside out.
So to get around this, the parasite evolved this absolutely brilliant survival mechanism, a toxic waste disposal system. It's a process called heme polymerization. And what it does is it takes all of that toxic heme and crystallizes it into a totally harmless substance called hemozoin. Pretty clever, right? This lets the parasite just keep on eating without poisoning itself. But this brilliant survival system is also its greatest weakness.
So this slide lays out the whole battlefield. It's a central conflict. The parasite's entire goal is to keep its waste disposal system up and running so we can eat safely. Our goal with antimalarial drugs is to completely sabotage that system. We don't even have to kill the parasite directly. All we have to do is stop it from taking out its own trash, and it will literally poison itself to death.
So let's see how this works in practice. We're going to open up our first case file on a classic class of antimalarial weapons, the 4-aminoquinolines. The most famous agent in this group is without a doubt chloroquine. It's an absolute workhorse of a drug that does exactly what we just talked about. It gets inside the parasite and just grinds that heme polymerization process to a halt. All that toxic heme starts building up and game over for the parasite. It's simple, it's elegant, and for a long time, incredibly effective.
Now what's interesting is that these drugs are used for more than just malaria. There's a handy mnemonic to remember their uses. Chills. So you've got C for chloroquine, H for hydroxychloroquine, I for infection with malaria, of course, L for both lupus and leishmaniosis, and S for systemic lupus erythematosus. It's a surprisingly versatile bunch of drugs.
Of course, no drug comes without potential side effects. The mnemonic here is blind fatigue, and it covers the main ones. The B for blurry vision and retinopathy is a really important one to watch out for, especially if someone is using it long term. A lot of the others like nausea, dizziness, fatigue, they're more common, but usually less severe. It's always that crucial balancing act between risk and reward. But what happens when the parasite starts to fight back, when it develops resistance to chloroquine? Well, that's when we have to bring in the next class of agents. Let's open the case file on the aryl amino alcohols.
The key players here are quinine and mefloquine. And what's so cool is that they basically use the same strategy. They also go after that critical heme detoxification pathway. This makes them absolutely vital for treating the strains of malaria that have figured out how to get around our first line of defense.
Their uses are super easy to remember with the simple mnemonic PAM. P is for prophylaxis, preventing an infection in the first place, like for travelers. A is for treating acute infections, especially severe ones, and M is for preventing malarial relapse, which can happen with dormant stages of the parasite.
And for side effects, we have the mnemonic crash N. Now this list has some serious stuff on it, like cardiac toxicity. And the A for anemia is especially important for people who have a specific enzyme deficiency known as G6PD. So again, these are powerful, powerful tools, and they have to be used with careful medical oversight.
So, now that we've looked at the enemy and our weapons, what's the big picture? What's the overarching strategy here? How do we put all this information together to actually win this battle?
Well, it really just boils down to this four-part plan. First, you have to know your enemy. You've got to understand its life cycle inside and out. Second, you identify its Achilles heel, which, as we've seen, is that heme detoxification process. Third, you deploy drugs that are specifically designed to sabotage that one critical weakness. And finally, and this is huge, you manage the side effects, and you're always on the lookout for drug resistance.
And that right there brings us to the final and most crucial question, because this battle, it isn't static. The Plasmodium parasite is a master of evolution. For every new drug we develop, it's working on a new way to resist it. So the real challenge isn't just winning today's fight. It's figuring out how our strategy has to constantly evolve to make sure we win the war tomorrow.